checkoff. This is Barbara Brown and Betsy will be my model for today. Before we start, Michelle and Amaury, thank you for everything. We wish we could have met you in person. All the best to you all moving forward. Okay, so starting at 5, 4, 3, 2, 1. Hi, my name is Barbara Brown and I am a University of Miami student nurse practitioner. I will be doing your assessment today.
Hello.
How are you doing?
Very good. How are you?
Okay, so can I ask you your name
Betsy Martinez.
and your date of birth?
1/9/1985.
Do you know where you're at today?
In the University of Miami Hospital.
And what's today's date?
January 29th, 2020.
Okay.
I mean July 29th, 2020.
Okay, so I just checked her mental status. She's alert, aware of her place and time and location and the situation. And now we'll start the full head to toe. I'm looking at Betsy from the head. There are no scars, no lesions on her head. She has a good texture of hair without any evidence of any hair loss. Have you had any recent hair loss, thinning? Okay, and now moving forward, we're gonna go ahead and assess her lymph nodes. Okay, I'll come from behind. And we will do the pre-auricular, post-auricular with the finger pads. And then the occipital, then I'm coming back over to the submandibular, moving forward to my tonsillar, submandibular, and submental, and then coming back, and I'm gonna do my superficial cervical, deep cervical, and my posterior cervical, and then come over here and I'll do my supraclavicular lymph nodes. All of them are soft, non-tender, and mobile. Okay, now moving forward, we're gonna look at her thyroid. You can stay like that, and I'm gonna locate the isthmus, and right below it, a little bit under by the cricoid cartilage. I'm gonna ask her to go ahead and swallow, and we let her take a swallow. Okay, when she swallowed, I didn't feel any masses, or there's no evidence of a goiter. No. So she swallows, it's good, it's mobile. Now we're gonna move over to her eyes. Had I had an ophthalmoscope, what I would have done, I would have went into her eye, followed the red reflex, look at her optic disc, look at her macula. And I will make sure, some of the common things that we may see are, you wanna see a normal, but some abnormalities would be papilledema or AV naking. Then moving, we'll do the ears, or we could do the nose. I'll go with the ears, and then I'll come to the nose. So I'm gonna gently get her argo and pull it up and gently backward away from the head. And with my otoscope, I will look for the tympanic membrane, and it should be pearly gray. I can see the cone of light without any obstructions, without any obstructions in the ear. And then I look at her nose. And the nose is symmetrical, it's beautiful, without any drainage, it's dry, nice and pink. Okay. And then we'll go over to her mouth. Looking at her mouth, if you could just please say, ah, beautiful. So her mouth is nice, pink, moist, without any ulcerations or lesions present. Her uvula is nice, it rises nice and symmetrically. Pharynx without any swelling. Okay, now moving, I'm going to check her lung sounds. But before I get to that, I'm gonna inspect. So when she came in, from the moment she came in, I saw she had respirations that were even and unlabored. I don't see her in any respiratory distress. Betsy, have you had any shortness of breath, any coughing? No coughing, okay. So I'm gonna check first for her excursion. So I come over here behind posteriorly, like this. And I will ask her to take a deep breath. And with the deep breath, I see that there is symmetrical excursion. Excellent. Now I'm gonna go ahead and I'm going to palpate for fremitus. Okay, so with the pads of my hands, the owner pads, I'm going to ask her to say 99,
99,
90,
99, 99, 99, 99.
Excellent. Okay, now I'm going to go ahead and percuss And then we'll do it in a ladder formation. Throughout the percussing, I don't feel any dullness. I don't percuss any dullness. It's nice. And now I'll go ahead and I'll auscultate her lungs. Deep breath, Betsy, in and out. And this is in ladder formation. So I would have started from the right. Go ahead, Betsy, in and out. And her lung sounds are nice and clear without any dullness. Again, I would have done a couple of exams. I would have auscultated anteriorly. I would have done the same method of auscultation anteriorly. And there are other things that we could have assessed for. And it would have been for bronchophony, egophony, and whisper pectorililoquy. Okay? With the bronchophony, if I would have heard an A instead of I would have asked her to say 99. With the egophony, the E would have heard like an A. And with the whisper particularly, it wouldn't be a whisper, it would be loud. And that would be confirmation possibly for lobar pneumonia. In her case, her lung sounds are vesicular throughout and clear. All right, Betsy, I'm gonna go ahead and ask you to lay back. And I will do your peripheral and carotid assessment at this time. Again, I'm looking at her precordium, and expansion is nice, symmetrical. I don't see any abnormal pulsation in the abdomen or up here. Okay, I'm gonna go ahead and palpate her carotid. Let's start with that. One at a time. I don't want to do two. Okay, that's a +2. And when I'm assessing, I don't feel any thrills. I'm gonna go ahead and auscultate with the bell of my diaphragm. One at a time. Hold your breath, Betsy, so I can hear. Very good. I don't hear anything. I don't hear any bruits or feel, and I didn't feel any thrills when I palpated, so that's normal. Now I'm gonna go ahead and auscultate her heart with my diaphragm. And I will start with the aortic at the second intercostal space to the right, moving over to the second intercostal space to the left, and that would be my pulmonic valve. Moving down to my fourth intercostal left sternal border, that would be my tricuspid. And right to the fifth, since she's a female, I will go ahead and displace her breast a little bit. And at the fifth, I should be able to hear her mitral valve. That's what I hear there, and all the sounds are normal. I don't hear any abnormalities. The rate and rhythm was normal. You can hear the S1 sound best at the apex, and the S2 best at the base. Had there been some abnormalities that you can auscultate with the bell of your diaphragm are murmurs, S3 and S4. So S3 you can auscultate best with the bell of your of your stethoscope at the base, and S4 I can hear best at the apex, and that's normal. S4 is a normal murmur that you can get as you get older. S3 is more with CHF. Okay, now we're moving over to her skin turgor, and she has nice skin turgor, supple skin, and I will check her pulses at this time. And I'll start with the radial, +2, brachial, +2, and then I'll come over to her femorals, +2, popliteal, +2, moving down to my tibialis, posterior tibialis, and then moving to the front to my dorsal pedis, and they all are plus 2. Now we're going to go ahead and auscultate her abdomen. Look at her abdomen, inspect her abdomen. And when I'm looking at it, it's symmetrical. I don't see any abnormalities or visible masses. So I'm gonna inspect, and then after I inspect, I'm gonna go ahead, thank you. We're gonna inspect and then when I go to auscultate, I'm gonna go from the right in a clockwise manner. Okay. Nice vowel sounds at the right upper quadrant. Vowel sounds present at the left upper quadrant. Vowel sounds at the left lower quadrant. Vowel sounds present at the right lower quadrant. And then I'm going to go ahead and percuss with my pleximeter and plexor. Nice and tympanic, no dullness. And then I'll go from a light palpation to a deep palpation. Again, light palpation. Do you feel anything, Betsy? Any discomfort? Have you been moving your bowels? Okay.
Yes, normal.
And when you eat, any nausea and vomiting? Okay. And then a deep palpation again to her 4 quadrants. And that will be it for the abdomen. And then we're moving over to our cranial nerves. All right, here we go. So Betsy, I want you to close your eyes. I want you to remove your mask. And we're going to test your cranial nerve 1, which is olfactory. Betsy, can you tell me what you smell?
Vinegar.
All right.
Smells like bad.
Nice vinegar. And then, Betsy, we're moving over to cranial nerve number 2. So I assessed her visual fields. With the Snellen chart, she has 20/20 vision. Then we're going over to cranial nerve number 3, 4, and 6. And that's for her extraocular motor. The 4th is the trochlear, and the 6th is her abducens. So I will get my pen light because I need to do this. I'm gonna check for light reactivity. We'll start with that first. Looking at her right now, her pupils are 4 millimeter, right? And then now when I do my light reaction with the pen light, they go ahead and they constrict to a 2 millimeter. So she's good with her light reactivity. And then Betsy, I'm gonna ask you to follow my pen light, and for her extraocular motor movement, I'm gonna see how her muscle strength is. You don't have to cover your eyes. I just want you to follow. We're gonna do an H pattern. All the way to the right, look all the way up, down, the middle, and then we're going to the left all the way up. Very good. I can see that all her muscles are moving. Her superior, inferior, abducens, they're all moving great. Now we're gonna move over to cranial nerve number 5. Betsy, again, I'm gonna ask you to remove your mask. And I'm going to, before I do the sensory part, I'm gonna do the motor part. I'm going to look at her masseter here and ask her to make like she's chewing or grinding, and I can feel her masseter muscles, they're nice. And then I'm going to ask her to keep her eyes closed, and I'm going to, for sensory purposes, see if she can have some feeling. Okay, tell me where I'm touching you, okay? Close your eyes. Betsy, where am I touching you?
My forehead. My nose. My cheek. My other cheek.
Okay. All right. All right, now I'm coming over here. So we did the motor, we did the sensory, and now I think we're good with that. Cranial nerve number 7 is her facial. And I'm gonna ask you for a nice big smile and a symmetrical, nice frown. Symmetrical, wrinkle your forehead, blow your, oh, okay. And then let me see you open your mouth and move your teeth. Beautiful. Excellent. Okay. Moving over to cranial nerve number 8, which is for hearing, vestibular cochlear. I'm going to do a whisper test. strengths. Now we're going over to cranial nerve number 9 and 10. That's glossopharyngeal and vagus. And I'm looking at her. She doesn't have any hoarseness present with her. Her voice is clear. And with the swallowing, symmetrical. Any issues swallowing?
No.
Then we're moving over to cranial nerve number 11. And I ask her for a shoulder shrug. Let's do it, Betsy. Let me see you. Okay, beautiful and symmetrical strength. And then hypoglossal will be cranial nerve number 12. Betsy, let me see your tongue. Stick out your tongue and to the side in the uvula. Let me see. It's nice and into the middle. No issues there. We're moving over to the deep tendon reflexes. Okay, so if you can sit to the side for me, Betsy, and we're gonna do some reflexes. With my arm, I'm gonna grab her and I'm gonna do her brachial reflex, and I'm gonna hit the hammer on my thumb, and I'm expecting to see a flexion. Okay, let's do it. Flexion. Brachioradialis, I'm right here at the brachioradialis, and I'm going to her forearm, and I'm expecting to see some wrist flexion and elbow supination. And the same over here. Wrist flexion, elbow supination. And then we're gonna do the tricep. And I'm expecting to see some elbow extension. Okay, moving right along. We are going to the patellar. When I do this, Betsy, relax. I got you. I'm expecting to see some knee extension. Knee extension. And that was patellar. And then for the plantar flexion, I'm coming over to the Achilles, and with the wider part of the mallet, I'm looking to see. Here we go. Looking for plantar flexion. And the other one. All right, and we're almost to the end of our video. We're going to do some muscle strength. Betsy, sitting like that, I want you to put your arms out and push. Don't let me push your arms down. Let me see how strong you are. There you go, the beautiful symmetrical strength. And now, Betsy, go ahead and try to push my arms down. Wow, and it's symmetrical, nice and symmetrical. And another one we can do is we can have her put her legs up like this, and she could keep them up for at least 20 seconds. Ooh, look at that, and she's strong. That's all because of the youth. And I think that we're going to just say this. When she came in, she had symmetrical strength walking, no issues walking. So I'm going to add that to my lower strength assessment. I would like to again thank you all for taking this time. We enjoyed it. It would have been even better had we been in person, because we truly appreciate Michelle and Amauri. Thank you all. On behalf of Betsy Martinez and Barbara Brown, have a great day. All the best. The end.
Ya. Se acabó.